Hi everyone, welcome to this fortnightly Tools of Frontline Staff session. We've got two presentations today, and I'm going to pass on to Mary from the Public Health team first. So yeah, thanks Mary for coming along.
You're welcome. Hi everyone, my name is Mary Federo and I am a Programme Officer from the Population Health Hub team, and we are a small team within the Public Health team looking at health inequalities within City and Hackney. So today, if you just bear with me, I'm going to share my slides. I'm here to talk to you about health literacy, but in particular, we have just recently revamped our health literacy toolkit. So I'll be here talking to you about that today. Bear with me, my laptop's a bit slow, so I'll just get my slides up on the screen. So while I'm waiting for my slides to come up, does anyone have an idea of what I mean by health literacy? You can either put it in the chat or you can speak if you like to. Put your hands up.
Is it like that knowledge that you need to make healthy choices or access good health things? Good health things, sorry.
Yeah, that's great. Anybody else?
Yeah, I was going to say the same, sort of having a good, I suppose, working knowledge of what's out there, I suppose, service-wise, but also, yeah, how to keep, healthy and maintain your well-being.
Yeah, absolutely. Well, you're both right. We're defining it as an individual's ability to be able to access, understand, and apply health information that they get, just so that they can make informed decisions about their health. But it's not just only about health decisions, it's also about well-being. It could be about benefits, it could be about social housing, just anything that impacts your health and your well-being. So we believe by reducing the inequalities within health literacy, it will actually lead to better health outcomes within our communities. So in order to be able to look at health literacy, we looked at different approaches, and we came up with a 3-tier or 3-level approach to be able to address that. So we had system level, we had organizational level, and then we decided to combine community and individual because we felt that they linked in very well together. So just to give you an idea of what we came up with at the 3 different levels, the first one being system level. As I mentioned, we had a toolkit, which we then revised because we asked for feedback. We wanted this to be not just another toolkit that, it's been created for people to use. We wanted to make sure that it's something that people found very useful. It had the right resources, and then also had good examples of what best practice is. On an organizational level, I'm not too sure if I think all of you should actually be aware of the MEC training, Making Every Contact Count. What we've actually gone and done is merged some aspects of health literacy within the MEC training as well. So hopefully when you guys have signed up to this training, you would have some health literacy aspects and learned a lot more about the 3 different ways that you can do it. So chunk and check and asking questions just in terms of scenarios. And then also on the community and individual level, we've been working with HealthWatch public reps, but just to be able to get a better insight of what health literacy looks like for them and whether they've got good ideas on how we can be able to empower community members and individuals as well. So just to mention quickly as well, it's not just the HealthWatch public reps. We've also been working with the community health champions as well, and then talking to grassroots organisations to see where we can get their insight on what best practice is for health literacy with them and their communities as well. So talking about the system level, and as I said about the health literacy toolkit, we got lots of feedback from different people that used it, GP practices. We also had the community health champions as well that had a look at it. We had the Health Watch public reps as well that reviewed it, and they gave us some great feedback in regards to user experience, what type of resources that they wanted, and also best practice. What I'll do after I've taken you all through the presentation, I'll quickly show you what the new health literacy toolkit looks like as well, so you've got a good idea. And I'll also leave the link in the chat, so in your own time you can go through it. And if you've got any other questions, please feel free to contact me as well. So based on the feedback that we got, the themes that we had was the need for more practical examples. We've done that on two levels, one within the MEC training, and also we've actually got a few examples on the health literacy toolkit. And then we've also got a case study where we had Dr. Pafan talk about how he's integrated giving health advice as well as religious outlook. So we had a imam from Homerton Hospital and a nutritionist nurse as well that talked to individuals about fasting and diabetes as well. We've also got some really good resources, so local resources from Hackney, and then also some from the city as well. We're not leaving the city out in this exercise. And then we've also made it a lot more easier to navigate. With the old toolkit, it was just an endless scrolling piece of document, but now we've got ways that you can be able to click to the section that you want to get to, and then we've also got a search function in case people want to look through it as well. So as mentioned, we've got some more guides, tips as well on strategies and clear communication. So how to speak, we've got a document checker where it will check whether your document is speaking in plain English and it's less jargons. And if you have got a lot of jargons, it will give you some advice on how to cut down on that jargon that you've put. And then also we've got a new checklist as well, which was provided by the Patient Information Forum. So you can be able to go through the checklist and make sure that the materials that you're sending out to individuals or communities will be more it's more tailored to having health literacy aspects. So as you can see, we've got things from the Hackney Council, we've got NHS resources, as well as something from the Health Foundation and the Public Health England as well. Has anyone got any questions so far? Is everyone doing well? No? Okay. So like I said, it will be great if just to be able to use the revised toolkit, continue. I'm not too sure of whether everyone's had access to it. What I'll do after this, I'll send the slide deck to John so that he can be able to circulate it to everyone. It'll be good if you, in your own time, you can be able to explore the toolkit. Let me know how that sits well with for you and your communities and whether you find that it's helpful. We've got some ways that you can be able to use these tools with your daily interactions. And then also we are very open to hear more feedback on how we can be able to make this a better toolkit for you. And I think just to give you a more clearer understanding of where this fits in with everything else that we're doing, we are actually now focusing on 4 different areas when it comes to health literacy and other areas. So with immunizations, because we know certain communities have a poor uptake when it comes to taking certain vaccines. We want to work better with, engage with other communities. So it will be our global majority groups that we have, just to have a better understanding of what the hesitation is when it comes to vaccinations. So we'll be working with the immunization team doing that. I'm also going to be working with Madeline and the digital inclusion work. They've got some digital buddies that they're going to be looking at better ways to be able to engage with people, because we know now that a lot of services have been taken online. And so we need it to be user-friendly. We need the information to be a lot more clearer and accessible, just to make sure that people are getting what they need when they need it as well. I'm going to be launching a health literacy awareness month. I don't know if anyone knows, but October nationally is Health Literacy Awareness Month. And we are hoping to be able to keep the momentum, get a better understanding of how people see health literacy. So if anyone's interested in joining in or any of the activities that we'll be doing, I'm still trying to put together a plan for the month, whether it's for your community or you just want to participate in listening into the lunch and learn sessions, or you have any resources that you'd like to share, please don't hesitate to contact me. And then also we are also looking at health literacy and faith. I understand that's a lot of people when they want to make really life-changing decisions, religion does come into play with this. So we are going to be working with those trusted individuals within those faith forums, which will be taking place in sometime in September. So I'll be getting in contact with them just to understand the community nuances when it comes to religion, health decisions, and individuals as well. So before I go on to showing you what the health literacy toolkit looks like now, just would like to know, is there any other additional support or resources that you feel that you need within the toolkit just to make your daily work easier? Or do you have any thoughts and comments up until this stage?
I was just going to say, I think you already mentioned it, but yeah, like some examples of how maybe you would see it being used by sort of other professionals with residents. That would be, maybe if there was like some case studies or something like that, that would probably be quite useful.
No, I agree. Sometimes seeing an example makes things easier just for you to put things in perspective. And sometimes when you see that, you actually understand that you are doing this work already. So if there's no other comments, I will share. I had some screenshots of what it looks like already, but as I was saying, this is what it looks like now. I'm not going to go through each of the sections, but just to give you a rough idea that now you're able to click on the side if you want to go to a section. So I've just gone to the using simple language. We've got some videos from the health literacy place as well that will provide more details into whatever you are reading. Like I said, we've got one case study at the moment. Sometime today. So we do have one case study. So we had a diabetes care model during Ramadan. As I said, Dr. Pafan, we had an imam from Homerton Hospital, as well as a dietitian. I think he's a dietitian. No, diabetic specialist nurse that was talking through a session about the impact of fasting, especially when you are not feeling particularly well. Having a local imam just to confirm and then also debunk any myths that anyone had was actually really good. And then you saw the impact that how people were really positive about it, and they wanted to have a lot more of those sessions. In regards to the local training, so we've got places that you can be able to go on e-learning support. We've got the MEC training. We've also got some digital inclusion support as well. That's for Hackney residents. And then we've got something for City of London residents as well. We've got this checklist that the patient information as well has created, and many, many other things as well. The Hackney Money Hub. Like I said, I'm not going to take you through all of it, but just to give you a rough idea of what it's looking like now and how you can be able to navigate it. I will put the toolkit in the chat, but yeah, that's it. That's all I got for now. Unless anyone's got any questions, please do. I'll put my email in the chat as well in case anyone wants to get in contact.
Abby, do you want to come in?
Yeah, thanks, Mary. That was incredible. It looks like so much work has really gone into creating that toolkit. I'm wondering, before we all get to dive into it, I'm thinking about the day-to-day work, and if we're putting together a document or if we're talking with someone in the moment, I think it can be hard to recall all the deep and detailed content we may absorb or read. What would you say are maybe the top, I don't know, 2 or 3 things that you keep in mind when thinking in a health literacy way in your communication?
Yeah, sure, Abby. And that's a fantastic question, because I, for one, I'm not a great person of trying to retain information in my head when I'm trying to have these conversations. But I feel like it's just taking your time and making sure that the person understands what you're talking about. So asking them whether they've understood what you've said, and asking them if they've got any further questions. Another good thing I feel it's to do is just to have a conversation like you're talking to a loved one. So example, if you're talking to your mom or you're talking to a child, how you tailor the information that is appropriate for them. I think it's really important. I think sometimes we get lost in the big words and trying to sound that, that we've come to grasp with something, but sometimes just keeping things really simple is always helpful. And you don't always have to have the right answer, but just be willing to be able to say that, you'll get back to them about whatever they've asked you for is always helpful. But yeah, I always just think about just keeping things really simplistic and just tailoring it to who you're talking to. There's some communities, bear in mind their background, there's cultural nuances as well, and being very respectful of that, I think, is always helpful.
Thanks, Mary. Does anyone else have any other questions? I was going to ask, because obviously you were talking about wanting feedback. Is it a continuous piece of work that's sort of always? Is it like a toolkit that's always going to be revised then, or is there like a cut-off point where the feedback has to be in by, sort of thing?
No, with this piece of work, I don't think it ever stops. It's forever changing, and you have to keep in mind, the times that we're in, there's different things that are going on, different communities have different needs. So I think I always believe in feedback. There's no, stopping to say that, I don't, or we don't want to hear anything from anyone else. I think taking in considerations the different things that different groups would need is always important, because then you're making it a toolkit that is well versed for them. So it's not going to be one brush that fits all. That's why we've got different things within the toolkit. So yes, it's not going to ever stop. And if it's a thing that it's not something that we can implement, it'd be a conversation to say that, okay, we weren't able to implement this now and then, but this is something that we can probably do just to work around it as well. So it's an open conversation, and we're always willing to learn the little nuances that each community has.
Amazing. I saw you might have already mentioned it, but were there particular groups or sort of parts of the system that you wanted to connect with the most, or like feedback from those people that you wanted that would be most helpful? Or
so I guess within so different groups for different things. So for immunizations, it was Black and global majority groups that we wanted to talk to. Also the Orthodox Jewish community as well. What I've tried to do, we've actually got a really helpful guy from Dr. Spitzer when it comes to the Orthodox Jewish community. He's written a book, which I've actually got the PDF version on the toolkit, that we're able to share information that people are looking at. So I think it's good if we can be able to get, different outlooks and insight of different groups, that would be really helpful. But no, I feel like it's not specific groups, but as long as we can be able to get information that does talk to those specific groups, I think it'll be helpful. Again, we don't want it to be like it's just one brush fits all communities. Yes, you're going to have the generic message, but again, I'm really mindful of nuances that each community has. So I'm willing to have an open conversation with anyone that feels that, you know, a little tweaking needs to be done. Yeah. I hope I've answered your question. I feel.
Yeah, you have. No, that's perfect. Yeah. Does anyone else have any other questions or feedback for Mary? Ho, did you want to come in?
Yes, hi. I'm Ho. I'm from Hackney Chinese Community Center. Yes, can you all hear me?
Yes.
Yeah, because it's a new microphone. Yeah, just let me check it. Yeah. So actually in September we will our center will change to an East and Southeast Asian community center, and according to our experience, we found that most likely the hepatitis B diagnosed in UK, we find that most of them are from the Asian communities. So now we are still have some primary draft plan about whether how we can support this group of people. And I find that Mary do a very wonderful job because you have different purpose with just like what you said before, that different communities have different needs. So perhaps if you or your team want to explore more about the need of the Asian communities, feel free to contact with us. Yeah, because we also want to find some resources to figure or to just address on these communities. For example, just like what I mentioned, the hepatitis B. Yeah. So and one more question. I find that you showed a list about the local training and support. How can I know that whether our center is suitable for you to put on the list so that to let more people know our resources or yes our service?
I can always catch up with you, Ho, and just have a conversation with you. I would love to have that, you know, conversation, see what we can be able to do.
Yes,
and then
great.
even that's another thing, Abby, as well. Like you were saying, translating it in different languages will be helpful because then you're speaking to them in the language that they're very comfortable with. So yeah, I'll be happy to contact you.
Yeah, yes, great. Yeah, translate to different language is one of our duties. Yeah, to let more communities know that how to access the resources in the mainstream service. Yeah, so we can keep contact later.
Yes, definitely. Thank
Yes,
you.
thank you, Mary.
You're welcome.
Yeah, I can email intro you two if that's helpful. That sounds like it'd be a really good conversation. Does anyone else have any other questions or feedback for Mary? No? Okay. Thank you so much, Mary. That was really good. And yeah, completely echo what Abby said. That seems like it's a massive piece of work. It looks really impressive. So I'll obviously send out your slides and the links and everything in the newsletter. Cool. No worries. We're going to move on to our next presentation. So I'm going to pass on to Beth, who's here from Positive East.
Hello. Okay, I'm just going to try and share my screen one sec. I'm not used to Google Meet, so let me just make sure I'm doing it correctly. There we go. Is that up working fine?
Yeah, we've got it.
Yeah. Oh, it's on the last slide though, so that's annoying. Don't know. There we go. Okay. So yeah, just kind of come today. I've joined you guys today just to give you a bit of an overview about Positive East. You may have had some emails come through from public health already through Frooks about our training offer. So it's kind of just partly promoting some of that to try and engage more with some different groups and just to give you an idea of who we are if you've not come across us before. So we're a charity based.
Sorry to interrupt. I'm not sure if we're seeing what you're seeing. We're still seeing slide 7, like before you've actually hit show slide deck.
I'm on slide 2. How weird. Should I stop sharing and start again? One sec. Has that worked? No, it's not even stopping sharing. 1 minute.
If you want, I could.
Okay. Oh, I did send it to you, didn't I? Let me try and
Yeah,
share it again and just see if it comes up. If not, it was just on the last slide. Was that? Maybe it was just.
Yeah, it
taken
was
on
just still on
Snapchat.
the sort of. It was still on slide 7.
Okay. What about now?
It's on. Yeah, it's on slide 1. It's still sort of not in the show slide function, if you know, the show
No.
presentation function. But we can still see it. We can still see slide 1.
Okay.
So
It might catch up if I just leave
yeah,
it on
cool.
there because it's on the slide function now. Let me know if it doesn't. Then if not, I'll try and fix it. But yeah, so we're a HIV and sexual health charity based in East London. Started off more as a HIV service, like as a helpline, about 30 years ago. So we're supporting people from the point of HIV diagnosis through their entire care journey. The mission of the charity is just sort of improving the quality of life of individuals and communities affected by HIV. We've got quite a range of different health and wellbeing programs, as well as the testing and prevention work that I lead on. Has it caught up yet, the slides? Or is it still not in a
We're
slide
still
show?
on slide 1. Do you want me to share my
Yeah,
screen?
maybe. Maybe my computer just doesn't like me.
Yeah, if you come out of it, then I can.
Yeah, fine. How weird. I'm a Teams person. But I only use Meet when I speak to people in Hackney. See if that works for you. There we go. Yeah, I mean, you can probably just go to slide like 3. It's fine. Cool. So yeah, that's just given me, obviously, this is all going to be focused more on Hackney and City, but we cover those 7, 8 East London boroughs. If any of your work covers into other areas of East London, you can link in with us there as well. Can I have the next slide, please, John? Thank you. This is our services. So the pink section of this is the prevention and testing side. So we have this HIV and STI testing service, which is community-based. We don't work directly in NHS services and things, so we'll be more based in different community settings. So could be a pharmacy, a pub, even a library. We've got a testing van that might sit out on high streets and engage people that way. And it's a point of care HIV test. So the results are 10 to 15 minutes. And then we'll do an STI screen as well if wanted, which goes back through BART. So that's your chlamydia, gonorrhea, hepatitis B and C, and syphilis. We provide sexual health information and advice. That could be just conversations on the street and outreach settings, online or through apps like hookup apps and dating apps like Grindr, or through our website. And Pat, that little robot out there, is a chatbot, AI chatbot sort of thing, that's all programmed in with different sexual health and HIV questions, and people can book through that in a easier way. We provide training for professionals, which I will go into a little bit later, and workshops in the community settings, which is more like for the service users and things rather than the professionals. Might be about HIV prevention or other sexual health needs, contraception, things like that. The dark blue boxes is just covering, just to give you an idea of how the support side works, the health and wellbeing program. So that's for people that are living with HIV anywhere in East London or accessing their care in East London. So we have peer support and mentoring, which could be in one-to-one, one-to-one mentors, or like a group support setting. There's both options available, and there's groups separated. There's sort of an all-together sort of social group. There's a group that's more based towards gay and bi men. There's groups that are more based on women living with HIV. So there's different range of options for people in that way. We have counselling and psychology services. There is a team of counsellors who would support anyone living with HIV, and then we have a psychologist who works more directly with women, and she had a specific program at one point that was supporting women that also had gone through experience and trauma and were also living with HIV. And she runs a lot of programs in that capacity. And then we have an information and advice service that's helping people with their benefits, housing, immigration, all of the other life complexities that come along. But again, for people living with HIV. I can go to the next slide. I also just wanted to give you guys a bit of an overview about a Hackney specific project that might be of use to you and your work. It's called Project Community, funded by City and Hackney Council, and its aim is to improve the sexual health and well-being of Black, African and Caribbean communities or other marginalised groups. But most of the work we're doing is within Black, African and Caribbean groups, as they're disproportionately affected by HIV and poorer sexual health outcomes. So, and also the only sort of aspect of our work that can also go sort of 16 plus, whereas most of all of our other work is 18 plus. So we can engage with young people as well around supporting them and making signposting into different services, providing information and advice, condom and lube distribution, again, workshops and things within the community. We have a befriending and advocacy service if people want someone to advocate for them in a clinic, they're not feeling confident to go and access the clinic on their own. We can support in that and try and get people re-engaged back into the primary care sexual health settings. And we also provide some small community grants to other organisations. So we've had one that's gone to a young person's organisation, for example, who was specifically trying to engage more Black, African and Caribbean people under the age of 24 in more, just to give them more information about the local sexual health services and things around in Hackney. Next slide, please, John. Thanks. So this is just the training that's been probably sent out to you guys through public health. So the HIV awareness training is the training we deliver more to professional organisations, statutory and non-statutory organisations. It will cover who we are, basically what I just did, but then we'll go into what is HIV, transmission, prevention, who's impacted, and the picture of how HIV looks now, particularly in London and East London communities. And we'll try and discuss stigma and addressing that and the fears and barriers of accessing care and how that could be impacting your service users and things. So we find, particularly in healthcare, there's obviously still quite a lot of stigma existing that can stop people going into for further support where needed. And we're trying to then sort of give this training to those health professionals, try and break down that barrier, because we had people sort of struggling to get additional mental health support because of their HIV status, and people feeling like they didn't know how to access another service that wasn't related to their HIV, if that makes sense. Also workshops, so depending obviously on all of your different jobs, if you've got community groups that you're working with directly, we can come in and offer a workshop directly with them. And that could cover a different broad spectrum of things. We mostly do it around sort of STI awareness and HIV prevention. We have a program that doesn't, at the moment, to be honest, work a huge amount in Hackney, but we can use a similar setup for Hackney, but it's about PrEP access for women. So we'll come in and do workshops with women and trying to increase uptake of PrEP in that community. And then we've also recently developed similar in that program, consent workshop, because that was coming up as a consistent issue of women and different understandings of what consent is. So we can sort of tailor some workshops to work for your community and your service users, and offer often a testing alongside that, and try and sort of do it in a space that they're already comfortable in at the end of the workshop if they're wanting to do that. And that's next slide, please. So that is it. That's who we are, basically. What I've come in for. I can give you, obviously, I'll answer any questions, but if there's some general questions you have that you would rather just email, you can email me directly, or I've also added in the community projects email. So if there's anything that you think is coming out of that Hackney specific project that might work for you, or you want to join the newsletter and just get some more information, that should go to you there. And that's it from me, I think. Anyone got any questions or anything?
Thanks, Beth. Yeah, does anyone have any questions? I was actually going to ask about, Josie, do you want to come in?
No, you go first, John.
Okay. I was actually going to ask about, you mentioned on one of the slides about the fact that there's people at Positive East who give advice around like benefits and that sort of thing. Do those people, where do they get their knowledge from? Are they like trained advisors, or do they sort of keep their ears to the ground sort of thing about what's happening locally?
They have some general, they will have trained knowledge around certain issues. They're not like technically like immigration. There's some work going on at the moment, I think, to try and increase our like immigration ability to get more advice than like actually and a bit of advocacy work for the people that are struggling to manage it themselves. So they are trained, they've got a good understanding of the system and of housing and benefits, and can sort of support and fight that for them, but they're not like full immigration workers.
Cool. Yeah, I was just wondering if like we could be put in touch with them, just because we're trying to get the word out about different things like around universal credit migration, for example. I'm sure they are aware of it if they're sort of clued up with the system in general, but it'd be good to connect and work together on getting the word out on those sorts of things, if that's
I have seen emails flying around from them sending stuff out to us about the like credit migration and stuff. But I'll get an email for you. That's fine.
Cool. Amazing. Thanks, Beth. Josie, did you still want to come in?
Yeah, it was just a question which might make me seem a little bit ignorant in a way, but having been around when it first sort of hit us, I was just wondering what is happening with HIV positive, etc. at the moment. What's going on? Because I'm a bit out of touch, I would admit.
Yeah, fair enough. That's what we're here for. That's why we come do the training. So obviously it's a very different picture to how it was 20 years ago, or even probably 10 years ago. The treatment is making it much more manageable healthcare condition that people can live in a long, same life expectancy as everyone else, sort of like healthy life. And also once on treatment, that stops transmission as well. So transmission rates are much lower. There is a slightly changed picture in terms of, because people are living longer with HIV, there's the aging population of people that are living with HIV and other like comorbidities that can come along with that. And so the support side of that is sort of changing, and people are learning how to navigate that in a different way. In terms of like new diagnosis, it is less, and there was obviously a bit of a weird dip of people not testing as much during COVID and not really knowing what those rates were really looking like. It is still lower than it even was a few years ago because of things like PrEP as well, that's preventing transmission as well as the treatment preventing transmission. And there's a reduction in like gay and bi men's new diagnosis, but not really the same reduction being seen in heterosexual populations. And there was a slight rise in women in London. There's also a chunk of the newer diagnosis, I can't remember the percentage, but it's fairly high, people that have been diagnosed still for the first time in the UK, but are like newly arrived to the UK as well, and haven't had the access to those services, or don't know how to access the services when they're arriving, of course. So yeah, it's better. And there's like, we've got the toolkit to stop it. It's just getting people testing, and like it could be, the aim is 2030, right? Which is closing in pretty pretty much. I'm not convinced we're going to have no new diagnosis by 2030. But yeah,
it's interesting because I lost a few friends to it at the height, and I have a few friends now living with it. But I guess my friend base isn't so in that bracket of sleeping around and more vulnerable to it. You know what I mean? And it feels like the pressure, the awareness would sort of dropped a bit, where it was now become a bit more controllable. The panic that my generation felt seems to have, I don't know, maybe that's just I'm an older person and I'm not, in connection. Well, I am in connection with younger people, don't get me wrong.
Yeah.
It doesn't seem to be a topic of conversation like it used to be, but so it's really good there's people out you raising awareness, because it's still such an important thing for people to know about, isn't it?
Still definitely an issue, yeah. And also I don't think there's a lot of young people that you'd kind of almost expect that people know what it is, know stuff about it, but I think it's not always really a part of sexual reproductive health education and things at school. Especially people weren't at school so much during COVID, because that kind of just disappeared, sexual health education. So that's another little barrier. But yeah, it's a different picture, but it's still an issue. There's still a lot of stigma around it and fear for people. Yeah.
Thank you for that. That's enlightened me as well.
Good and bad.
Got my finger on the pulse now.
Thanks,
that sounds a bit rude, actually.
Cool. Thanks, Josie and Beth. Does anyone else have any other questions or feedback for Beth? No. Okay. Well, I'm going to obviously share Beth's slides in the newsletter, so you'll have her details and be able to look into those and think about maybe taking up the offer of the training, which sounds really good. But thanks, Beth, for coming along. That was really interesting.
No worries. Thank you.
Cool. Cool. So there are two presentations. So we now usually just open up the floor and have a sort of open discussion. If anyone's got anything they want to bring up, promote, anything they're doing in the next, in the next few weeks or after the summer that they want to promote to the rest of the group, now's your chance. I was wondering actually, Ho, if you were up for it, would you be able to sort of briefly explain the champions role and the sort of the work you're doing with them?
Yes, sure. Yes. Thanks, John, to provide such opportunity for us. So maybe let me introduce myself again. Yes, I'm Ho. I'm from Hackney Chinese Community Center, and our center will change to EA Center in the September. Yes. So 1 month later, you can see our Hackney Chinese Community Center again. The name will be changed. Yes. So actually, I have two roles in the Hackney Center. One is focused on the well-being service about the East and Southeast Asian, and other role is the community organizer, which is why I'm here now, because that project is funded by GLA. So John and I prepared that funding is because we find that recent few years there are a lot of Hong Kongers arrived to UK, and around there are around 200,000 Hong Kongers now are here due to a lot of reasons. And according to the BNO screen, the Hong Konger will become the resident after 5 years. So we anticipate that there will be a greater urgency and desire for the Hong Konger to understand their entitlements as the permanent residents, how to what's the welfare in UK, how can they use the social resources. I think most of the Hong Konger, they don't know the details. So John and I want to train up some of the Hong Konger, especially for the ones who are the Hong Kong social worker before and after they came to UK. We want to train up them as a community champion so that they can be equipped with the knowledge of the public service and the welfare entitlements. And after after the training, they can become the community assets to serve the Hong Konger, so that not only to raise the awareness, but also to be the bridge between the Hong Kong communities to the mainstream service, to the main community. So I think this is something similar like what you all done in your organizations, because all we have done now is to be the bridge between the communities when they have the need, but they don't know what resources they can use to help themselves. Then we can become the bridge to help them to access the information. So there's some background information and what we will do later with not only me, but with the community champions in Hackney Centre.
Great, thanks. So yeah, this is all. This is part of some work which, funding that we as in Hackney Council applied for from the GLA, and Ho and his colleagues at Hackney Chinese Community Centre are doing a brilliant job in implementing the grant. And yeah, the sort of champions is just one part of it, isn't it? So yeah, if people want to link up with Ho and pass on information that he can share with the champions, then give me a shout and I can put you in touch.
Yes, thanks. So I think not only for the Hong Konger, but also I think we can, just like what Mary mentioned, we can be the first become the translator, yes, to release the language barrier. And the second, I think we are, I think for the Asian communities and the Hong Konger communities, they will be easier for them to trust us to introduce the service for them. For example, just like the positive is, right? Yes, I think it is very useful. The information is very useful, yes, but they may not know the details about this organization. So after we introduce to them, they will be more willing to access the information, the resources.
Nice one, thanks, Ho. Cool. Does anyone else have anything they want to share with the group? We've got quite a bit of time left if people want to promote anything or ask a question of the group. Rachel?
Yeah, so it's just another sort of plug for the sort of move to universal credit work. So we have got some early figures from Benefits and Housing Needs, because they can tell who's migrated from housing benefit statistics. Not all universal credit sort of people who are migrating are on housing benefit, but probably most of them are. So there's about 1,500 that have migrated so far out of about 7,500 housing benefit claimants that we know of that are going to be migrating, of which 75 have received termination notices. So 75 of those hadn't migrated within the first the 3 months that they're allowed. I understand that of the first 20 that they looked at, 40% of them had in fact migrated after that 3-month period, in the month following that 3-month period. So that is a better outcome than we thought, although, a lot of the more vulnerable people have yet to, start the process or are still in their 3 months. But so it's a good start, but there's no room for complacency. But one thing I did notice with the data that I saw, I think I only saw about 49 records, but a lot of them were in the private rented sector, which is obviously, you wouldn't be surprised by that, because they don't have, they don't tend to live on estates. They don't, have those sort of networks. They don't have housing managers. They don't have newsletters. They don't have that sort of housing plus support. So, so if you do in any way work with people in the private rented sector, or please do share the information. We've actually got printed materials now, which I can get you if you need them. Colleague Martin Mallin in comms has got a stock of printed leaflets and posters. So yeah, I've tried to get hold of the London Renters Union, the Hackney branch of that. I know that's quite big, but any sort of networks or services that that particularly reach people in the private rented sector, then please do kind of reach out to them or let us know, and we can sort of target them with information. Yeah. Yeah, Josie.
I just want, yeah, my thing's off. I just want to apologise actually because I've got an email from you. I just haven't had a chance to reply to it yet. Sorry, I was off last week. So, but thanks for the email. We're getting direct sort of contact from Universal Credit. They have a Wednesday weekly meeting we can join, so that's really good. But I'll reread your email and come back to it if that's all right. But sorry I hadn't replied sooner.
Yeah, no, I did. I just emailed you as somebody who I thought that would come into contact with private tenants. But I think, they are like one of the most isolated. They're probably the furthest from public services. They're not they're quite isolated. They might have a landlord who's only got 1 or 2 properties. It's not like some of the landlords do own hundreds of properties and have a bit of an infrastructure, but it's not like Hackney Housing. They've got, tenant sort of income officers and people who can chase you up if you don't pay your rent. Very often it's just like an eviction notice if you don't pay. So, we just have to get to those kind of quite isolated people, really. Public, and public health champions. Yeah, who do I need to speak to? Who runs the public health champions?
Joy? Is
Yeah.
it? Am I getting that right, Charlie?
Ross Jones from Public Health.
Okay.
I'll send you her email in a chat, Rachel.
Okay. Yeah. Okay. I think we might have, reached out to him before, but I will do that again. Yeah.
Thanks, Rachel. And I'm continuing to put all the sort of resources and materials in the newsletter on UC, so people can look out for that. Abby, did you want to come in?
Yeah, one thing on universal credit migration, our comms team has been able to print off some of the really basic flyers. In fact, so basic that I had to ask, is there information on the back? But it's got the link. It's so basic that it's got just a really simple, I'm trying to remember the exact phrase of kind of help to move to universal credit, and then just a really short link and a QR code. If you would like any of those flyers, they've got a bigger one that could be posted on a board, and they've got quite a few that are meant to be handouts that do have a blank back page that could be written on if you're giving information to anyone or wanting to connect them to any further support. Let me know. I'll put my email in the chat here, because we're going to be distributing those, but we want to make sure the people who see the value of them or would want to use them are getting them.
Nice one, thanks, Abby. Abby, did you want to talk about the coffee mornings and explain to people what's going on with that?
Yeah, absolutely. So I think, John, you shared a bit about this last week. So if anyone was on the call last week, you may have heard this from John. But let me get the link up here that I can actually share with everyone. What we're doing, John and I have been working with some colleagues in Hackney Education, and we have been trying to work with schools who were sounding the alarm of basically saying there are a lot of families that they're seeing that are facing hardship and struggling. And they were wondering, what are some of the support that we can give them? Is there anything else that we can help kind of wrap around them or provide them with? And so through this work, we've been trying to figure out what is the way to build the relationship with schools and maybe even start to equip their staff, not in the exact same way that we're doing the tools session here, but in a way that starts connecting the staff that the schools have to support, for like the pastoral care and to support families, to connect them with the useful information and the useful people that might be nearby. That's a long-winded way of saying what we've been doing with the funding that we have from the Household Support Fund that we've been using is, in the first instance, saying what direct support can we give to families. So currently we're sponsoring some families who don't qualify for their kids to get the Holiday and Activity Fund program sponsorship, but are just above to be able to attend a summer program, working with some of the schools that were sounding the call to us. And then through that, also having some coffee mornings, some back to school coffee mornings. So in September, we'll be doing some coffee mornings that we want to be community coffee mornings. Oh, and where's the preview here? I'll share my screen just so we have the visual. We're working with 9 schools. We know that that's not all. Trying to talk and multitask is not my strong suit. You can read this if you follow the link, and we do encourage you to sign up. But we're working with 9 schools, 8 of which are primary schools. One is, where is it? Urswick Secondary School, to run coffee mornings, and asterisk, Urswick is actually a coffee afternoon to better fit with the secondary schedule for parents. But to create a coffee event where we can connect carers, parents, families with the community support that might be around the school, with some of the services that might be available to them, to lean into what I think all of us on the call believe, that by putting faces and people behind the services, that sets people up better. It makes it easier to reach out to someone. It makes the information about what's out there feel a bit more personal and a bit closer. So we want it to be an event that does have a positive feeling to it. We want to get people in, like we're working with our 10 by 10 person who's going to be having a table there for the 10 activities that we want, an initiative to get 10 activities for kids before they're the age of 10. We're reaching out to different community partners and frontline services like you all, and really just want to have a space where there can be different tables and conversations between families, carers, and all of the wonderful support that's around. So what you'll see on this form is the list of schools and the location. I don't know about you, I'm a very visual person, so being able to see where things are. And we thought, instead of us arbitrarily drawing a boundary of how far away from a certain school gets out of its kind of neighborhood, that you could be looking at this and say, well, I'm located near the Wells Street Commons. It could make sense for my organization or my team to attend the 5 in the bottom right-hand corner of the map. But we wanted this to be kind of, you look at the map, decide what makes sense based on availability and which schools would make sense to connect to. And then the final thing to just note here is that timing has not been a friend to John and I. We have been working to get all of the dates and times really confirmed, but school holidays, of course. So there are a few that have an or on the dates. So you might see, for instance, the first 2 on this list are an either or. So either St. John of Jerusalem or Queensbridge would happen on the 17th or 18th. And then St. Dominic's further down that list, we're confirming whether it'll be the 24th or the 25th. And then for all of the times to be confirmed, they're in the morning, they're coffee mornings, but we don't know if it'll be a 9 a.m. start or a 9:15 start. Very possibly a 9:30, but generally in that time frame. And that is what we wanted to share about coffee mornings. Can I answer any questions about it? Yes, Ho, go ahead.
Yeah, so it's so amazing because you have reached a lot of schools in Hackney. Yeah, from north to east to south to west, actually, all around the Hackney. gone. So may I ask whether there is some East Asian communities in this school, or if some materials about the Southeast Asian service is useful, then we can also share to you, and then you can bring the material to the school. I don't know whether it is possible or it is suitable for you. Yes.
Thanks for asking, Ho. I don't personally know the schools well enough, but that's a really good question that I can take back to our education team to see.
Yes, because according to the census, there are around more than 10,000 people who are the Chinese or the Vietnamese and the Malaysians in Hackney. Yes, and I believe that they will have the family and the children, and the children will need to go to school. So if their children are in this school, you will wish them, maybe I don't know whether they will feel interest about the service for the Chinese or for the Vietnamese.
That's a really good point.
Yeah.
I've just made myself a note under my coffee mornings list to get more information about the specific demographics at these schools that we're working with.
Yes, thank you. Thanks.
So, and Joycelyn, hi Joycelyn, just seeing your question about the target audience. And I'd say it's the parents generally, but we're really working closely with the school heads at each school that is on the list, who know their families very well. And it's the families that, again, right above, the ones that they seem to be worried about are the ones who are right above being eligible for a lot of benefits. So they're going to be working with us closely to send out the invitations. Of course, it won't be limited to just those parents and families. It'll be a general coffee morning, but specifically we're hoping to directly invite the families that are just above. And a lot of those families we're also currently working with to sponsor their kids to go to one of the summer programs. So we're seeing this as kind of the journey with them.
Thank you.
No worries. Any other questions we can answer? All right, well, I'm going to stop sharing that screen. And John and I might also be reaching out specifically to some people that we know are in certain areas, just because we know that sometimes a personal email helps when you walk away from a meeting at the end of the day and forget to fill out a form, for instance. So if you hear from us, it's because we really want to see you there. We think you're so important. No. And if you don't, that's not because we don't think that. I backed myself into a corner there, John. I also wanted to share something else that I'm a little bit further away from, but thought that this would be a good group to say who needs this information for their boards, their windows, the people that they work with. So in picking up the said universal credit flyers and pamphlets the other day, a colleague in the communications department also had these flyers available, private sector housing survey flyers, because there is currently a draft of the private sector housing strategy that the people who have been working on that strategy really want to get some feedback on it. So there is a consultation process going on, a feedback process going on. And this flyer would be pointing to that engagement and the consultation for that strategy. They've got them available in the A3 size, so quite big. And I guess the question to the group is, A, who wants one? And B, who wants one but doesn't want the A3 size? Because I guess our in all seriousness, our colleagues in the communication department said, if this is too big, let us know if a smaller size would be more helpful. So those are the two questions posed to the group. And I suppose you can also put your contact info in the chat if you'd like one. We can follow up with you. Does anyone on the call actually know a little bit more about the private sector housing strategy and want to share at this point? Because it's something that was new to me.
Yeah, I don't know too much about it. I don't know if you do, Charlie, or perhaps not.
Yeah, Charlie.
I'm afraid I don't know any more about the private sector housing survey, but I thought this might also be a useful time to plug next week's session. Session in 2 weeks, which is where Helena Stevenson from our Hackney Housing Service is also doing consultation on what they need for additional residents with additional needs to thrive. So there's a consultation going on from Hackney Housing. Helen is going to come and talk through it a little more detail in our next tool session. But if you wanted to access that survey as well, I'll just put a link in the chat. I know that's quite a lot of survey talk. Hopefully Helen's going to come and give that a bit more kind of life at the next session. I'm afraid I don't know any more about private sector housing. Wasn't my bit of the housing world.
Cool, no worries. Thanks, Charlie. I can share those. I can share that that leaflet or in the newsletter as well, Abby. So people will have it there if they want to feedback.
That sounds like a good idea, John. I think really, if anyone just wants the hard copy of one to hang up somewhere or to have, reach out to me or any of us on the team, and we can get one of those to you.
Cool, nice one. Thanks, Abby. And I'll be putting the other form, the school coffee mornings form in the newsletter as well. So if you want to let us know if you're able to come, which ones you want to come to via the form, you can do that as well. Ho, did you want to come in?
Yes. First, we can have one A3 size poster. Yes. 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 Second, I'm thinking whether it is useful if we translate this to Chinese and Vietnamese and send you back, and so can prepare another Chinese and Vietnamese version for us to post in our center. Yeah. So that, because I think most of our members they are now renting rent their house in Hackney, so maybe their opinions are also relevant.
Yeah, I think that would be great. I actually don't really know what I'm sure the private sector housing team and the consultations team would be up for that. I don't know what the process would be for. Yeah, I don't know if they have to sort of like sign off.
No worry.
But I can definitely, if you email me, Ho, I can probably find out for you and put you in touch with the right people. But yeah, it's a great offer, and I think that'd be really useful. Yeah.
Yes. So yes, maybe if we can help to translate, then we can just keep contact.
Yeah, fantastic. That'd be brilliant. Cool. We've still got a few minutes left. If anyone else has anything else they want to ask about or promote or ideas for people you want me to try and get to come and talk to the group. Yeah, in the next meeting, we've got the presentation on the additional needs policy. Charlie, did you want to come in?
Just a really light plug. If you are running a community organisation and would like some energy advice to be delivered at that community session by an independent organisation delivering energy advice, if you contact me, we'll try and put you in touch with them. An organisation we're working with called Crew Energy, who are delivering advice in the borough, and will be doing so over the winter period. I know it's kind of slightly muggy and Augusty outside, but winter is going to come around very quickly. So something that would be useful for you and your organisation, just drop me a line and we can try and get you an appointment, or at least kind of figure you in our planning over the next few months. And I'll put my email in the chat.
Nice one, thanks, Charlie. And I was actually just gonna, October feels a long way away, but I think we are going to be doing a in-person version of this meeting, which we're calling Tools Live. I think we're going to be having it at Carabeats, which Ali from Carabeats is often on these calls. So people who regularly come to this will know Ali, and she is going to be hosting us. And I think it's probably going to be October 3rd. So it's a couple of months away. But I just wanted to soft launch that and put that on your radar, and we'll continue talking about it in the meetings in between now and then. But yeah, I thought it would be good to get everyone together in person, because we've been doing these meetings for, it probably will be about 2 years by the time of October the 3rd. And yeah, it's a good space, and yeah, been great to sort of collaborate and work together in these meetings. So yeah, we thought it'd be a good opportunity to bring people together in person. So yeah, just putting that on everyone's radar, and we'll talk about it more closer to the time. Cool. If no one else has got anything else they want to share or ask about, Abby.
Sorry, I feel like I've been talking way too much on this tool session, but I was just thinking about a resource that our colleagues at the Hackney Food Bank shared that is about the free days out. So they've got a part of their website has a page that's got free things to do this summer. So if you know any families that are looking for low cost options of taking their kiddos out, the link that I just put into the chat is a good resource to check.
Nice one, thanks, Abby, and I'll put that in the newsletter as well. Cool. I think we'll wrap up there then, unless anyone else has got anything they want to add. We'll give you 14 minutes back. And yeah, thanks everyone for coming in, and for Beth and Mary as well for presenting. And yeah, hopefully see you next time in a fortnight. Thanks everyone. Bye-bye.
Thank you. Bye.
Thanks.
Bye. Thank you.
Thank you. Bye.
Take care, everyone.
Thank you. Bye-bye.
Bye, everyone. Thank you.
Bye, Euphemia.
Hi, Sam.
Let's see.